If you're a woman over 70, or you love someone who is, please don't scroll away. Because what I'm about to share could truly protect your health, your peace of mind, and even your quality of life. Every single day across the United States, older women walk into their doctor's office and are told they need more medical tests, blood work, mammograms, colonoscopies, scans, biopsies. And most of them say yes, because that's what we've been taught to do. We trust that every test ordered is meant to help us. But what if I told you that some of those routine tests can actually cause more harm than good? I'm Dr. Lisa Perriera, a board-certified gynecologist with over 30 years of experience caring for women through menopause and beyond. And after decades in practice, I've seen far too many women go through painful, unnecessary procedures, not because they were truly needed, but because no one ever told them they could ask questions. The truth is, the medical system often follows protocols designed for younger adults, people in their 40s or 50s, not for women in their 70s or 80s. And what might save a life at 50 can sometimes put that same life at risk after 70. I've seen women hospitalized after routine biopsies. I've seen others lose mobility or confidence because of complications from procedures they never actually needed. Let me tell you about one of my patients, Eleanor. She was 76 when her doctor ordered another mammogram, even though all her previous screenings had been normal. The test showed a tiny mass that turned out to be slow-growing and harmless, but the biopsy that followed caused bleeding, infection, and weeks of recovery. The treatment left her exhausted, anxious, and afraid to trust her body again. The cancer wouldn't have shortened her life, but the procedures nearly did. And Eleanor's story isn't rare. It's one I've heard in countless forms over the years from women who trusted the process only to end up hurt by it. That's why I'm recording this video today. Because it's time women over 70 understand that more medical testing isn't always better. Sometimes less testing actually protects you more. In the next few minutes, I'll walk you through 5 medical tests that are still routinely ordered for women over 70, even though leading research from the Mayo Clinic, the NIH, and JAMA shows they may no longer be beneficial, and in some cases can cause real harm. You'll learn what questions to ask before agreeing to any test and how to talk with your doctor so that your care reflects your age, your health, and your priorities. And I want you to remember something important as you listen. Saying no to a test doesn't mean you're refusing care. It means you're choosing smarter care that values your comfort, your independence, and your years ahead. Before we dive in, please take a moment to subscribe if you haven't yet. Every week, I share evidence-based advice to help women over 60 and 70 navigate health hormones and aging with confidence and clarity. Now stay with me until the end, because what you're about to learn could save you or someone you love from unnecessary medical harm, anxiety, and pain. Let's begin with an uncomfortable truth that few doctors ever explain: why some tests that save lives at 50 can quietly take away quality of life after 70. Most women don't realize this, but the way doctors are trained to order medical tests hasn't really changed in decades. The same protocols written for younger adults are often applied to women in their 70s and 80s, as if aging doesn't change how our bodies react to procedures, anesthesia, or even simple blood tests. And that's where so many problems begin. In my practice, I've seen women come in frightened after being told they need immediate follow-up testing for something small, a shadow on an X-ray, a slightly high lab value, or a borderline scan result. And what often follows is a cascade of worry, more tests, and sometimes invasive treatments that were never truly necessary. I call it the domino effect of over-testing. One test leads to another, and before you know it, you're dealing with complications, medical bills, and sleepless nights over something that might never have mattered. Here's what the medical system rarely explains after age 70. The balance between benefit and harm shifts dramatically. A test that helps catch early disease in a 50-year-old may only add anxiety or even injury for a 75-year-old woman with other health priorities. It's not about ignoring medicine. It's about applying medicine wisely. According to research from the Mayo Clinic and the US Preventive Services Task Force, many tests once considered routine provide little to no survival benefit for older adults. In fact, some can reduce overall quality of life by leading to unnecessary procedures. And yet they continue to be ordered every day because the system rewards doing more instead of doing what's right. Let me give you an example. A few years ago, a patient named Margaret came to me for a second opinion. She was 80, living independently and in good health for her age. Her previous doctor had recommended a colonoscopy simply because she hadn't had one in several years. But Margaret had already undergone multiple normal screenings in the past. I explained that after 75, the risk of complications from colonoscopy, bleeding, perforation, anesthesia reactions was much higher than the chance of finding a cancer that would ever impact her life expectancy. When she heard that, she looked at me and said, "No one ever told me that before." She decided to skip the procedure. 3 years later, she's doing beautifully still gardening every week and hasn't missed a single family gathering. That's what informed care looks like, choosing what serves your health, rather than blindly following a checklist. But I don't blame patients for not knowing. Most of the time, doctors simply don't explain the trade-offs clearly. Sometimes they're afraid of being seen as neglectful. Sometimes it's just habit. But as women, you have every right to ask, "Will this test actually change my treatment or just create more anxiety?" Think of it this way. Imagine your body as a beautiful, intricate clock that's been running faithfully for decades. When you're younger, checking every gear and tightening every screw might make sense. But after 70, constant tinkering can wear down the mechanism instead of preserving it. Gentle maintenance focused on balance, comfort, and quality is far better than overhauling every part. And this is exactly what I want you to remember before agreeing to any new medical test. Always ask. 1. How will this test help me at my age? 2. What are the risks of doing it and of not doing it? 3. Will the results actually change my treatment or just create worry? In just a moment, I'll walk you through the 5 specific tests that most concern me, the ones that major studies show often do more harm than good for women over 70, and I'll share exactly what to ask your doctor before you agree to them. Because protecting your health after 70 isn't about doing more. It's about doing what truly matters. Let's start with the first test that worries me the most, one that countless women and men over 70 continue to undergo even when the evidence clearly says it's unnecessary. The PSA test, or prostate-specific antigen screening, is often ordered for older men, including husbands or partners of many women watching this channel. It's supposed to detect prostate cancer early, but after age 70, it rarely saves lives. The Mayo Clinic and the US Preventive Services Task Force both warn that PSA screening in men over 70 can cause far more harm than benefit. Most prostate cancers discovered at that age are so slow-growing that they'll never become dangerous. Yet once that test shows an abnormal result, it triggers a painful chain of biopsies, treatments, and lifelong complications such as incontinence or erectile dysfunction. I've seen wives watch their partners go through all that suffering, hospital stays, infections, exhaustion, only to learn that the cancer would never have shortened their life. The question I always teach couples to ask is this: given his age and health, is this cancer more likely to harm him, or will the treatment do more damage than the disease? Now let's talk about the second test, colonoscopy after 75. Colonoscopies are valuable in midlife, but as we age, our risk of complications skyrockets. For women over 75 who've already had normal screenings, the risk of perforation or bleeding is several times higher than in younger adults. Anesthesia alone can cause confusion falls and delayed recovery in older patients. Yet many doctors still recommend one more screening, even when the likelihood of discovering a dangerous new cancer is very small. If your last few colonoscopies were clear, ask your doctor. What is my actual risk of colon cancer now? And is there a less invasive option, like a stool test, that gives similar information without the same danger? The third test I often question is mammography after 75. For decades, women have been told that annual mammograms save lives, and they do for younger women. But for women over 75, the data changes. Studies published in JAMA Internal Medicine found that mammograms in older women detect many small cancers that grow so slowly they would never affect lifespan. Yet once they're found, they lead to surgeries, radiation, and chemotherapy that take away energy independence and comfort. I still remember a patient named Ruth, who was 81 when she underwent surgery and radiation for a small tumor found on a late-life mammogram. It left her fatigued and in pain for the rest of her days. The cancer itself was so slow-growing that it would never have become dangerous. I'll never forget her words. "Doctor, I wish someone had told me that doing less could have been safer." So if you're in your late 70s or beyond, ask your doctor. Would finding this type of cancer truly change my life expectancy, or would it only reduce my quality of life? The fourth area of concern is aggressive diabetes management. I see this constantly. Older women prescribed strict glucose targets meant for middle-aged adults. Doctors push to bring the A1C down below 7, thinking lower is better. But for women in their 70s or 80s, that kind of tight control can cause dangerous drops in blood sugar. Hypoglycemia leads to confusion, falls, fractures, and hospital visits. In fact, the American Diabetes Association now recommends relaxed glucose targets between 7.5 and 8.5 for older adults with limited life expectancy. So if your doctor is urging you toward very tight glucose control, ask, what's the safest range for me, given my age and health? Could aiming higher actually protect me from hypoglycemia and falls? And finally, test number 5, routine imaging CT scans, MRIs, or PET scans done just to check. I know many women who have been told, let's do a scan to make sure nothing's hiding. It sounds reassuring, but these scans often find harmless abnormalities, tiny spots on the lung, small cysts on the kidney, tiny nodules in the thyroid. Once they're discovered, they trigger more tests, biopsies, and procedures that can cause real harm, even though most of those findings would never have mattered. A major JAMA study found that incidental findings from imaging in older adults led to unnecessary procedures in nearly a quarter of cases, with no improvement in survival. The radiation exposure itself can also be harmful. So before agreeing to a scan, always ask what symptoms make this necessary. What are we hoping to find, and would the results actually change my treatment plan? You see, it's not about rejecting medicine or refusing testing altogether. It's about applying wisdom. After 70, the goal of medicine should shift from detection at all costs to preservation of comfort, independence, and dignity. A few years ago, I met a patient named Harold who changed the way I talk about medical testing forever. He was 78, gentle and soft-spoken, the kind of man who always showed up to his appointments with a folder full of notes and questions neatly written out. His wife, Susan, sat beside him every time. One afternoon, Harold came in visibly anxious. His primary doctor had recently ordered a PSA test, even though he was well past 70. The result came back slightly elevated, and without much discussion, he was scheduled for a biopsy. Within a week, he developed a severe infection that landed him in the hospital for nearly 10 days. When he finally came to see me, he was still weak, exhausted, and frightened. We reviewed his test results together, and what I found made my heart sink. The biopsy had revealed a small, slow-growing prostate cancer, the kind that would likely never cause problems in his lifetime. Harold's overall health suggested he had maybe 8 to 10 healthy years ahead of him. The cancer, on the other hand, would have taken 15 to 20 years to grow into something life-threatening. I told him gently, "If we treat this aggressively, you'll face side effects that could take away your comfort and independence for the rest of your life. But if we simply monitor it, what's called active surveillance, you can continue living as you are." Harold looked at his wife and then back at me. I could see the tension in his face slowly easing. He said, "So doing nothing might actually help me live better." And I smiled and said, "Sometimes the best medicine is knowing when not to act." He chose surveillance. 5 years later, I received a letter from Susan. She wrote that Harold was now 83, still walking their dog every morning, still gardening, still laughing. The cancer hadn't progressed at all. She ended the letter with one line that I'll never forget. "Thank you for giving us our peace of mind back." That story captures the deeper truth about aging and medicine. After 70, the goal is no longer to chase every possible diagnosis, it's to preserve the life you already have. Because what good is adding years if those years are filled with pain, fear, and hospital visits? When I think about the hundreds of patients I've seen in similar situations, a pattern becomes clear. Many of the tests that cause the most harm come from good intentions. Doctors want to protect you, but too often they rely on outdated rules that don't fit your stage of life. The result is overdiagnosis, finding and treating conditions that would never have mattered. Think of it like pruning a tree. When it's young, you trim it often to help it grow straight and strong. But when it's old and full of character, pruning too much can damage it. The same is true of the human body after 70. Gentle care, patience, and trust often yield better results than constant cutting and testing. I've watched too many patients spend their final years dealing with side effects from procedures they never needed, pain from surgeries, weakness from aggressive treatments, anxiety from false alarms. And I've also seen what happens when people make informed choices. They live longer, happier, and freer lives. So before you agree to another routine test, remember Harold's story. Remember that sometimes protecting your life means protecting your peace. Ask questions. Slow down the process. Demand explanations. Medicine should serve you, not the other way around. Before you agree to any new medical test after 70, I want you to pause and ask 3 powerful questions. These questions can completely change the way you experience healthcare, and they can protect you from unnecessary anxiety procedures and even harm. The first question is simple but crucial. What is my realistic life expectancy based on my current health, not just my age? If your expected lifespan is under 10 years, many cancer screenings offer little to no benefit. The goal is no longer early detection at all costs, but maintaining the comfort and quality of the years you already have. The second question to ask: if this test finds something, what will the treatment involve and what are its risks? It's one thing to discover a condition. It's another to treat it. Many tests find slow-growing issues that might never cause problems. But once they're found, treatment becomes almost automatic, leading to surgeries, radiation, or medications that may create new problems. So always ask, what would treatment look like for me? And will it actually help or only make life harder? And the third question, what does the medical evidence say about this test for people my age and health status? Don't be afraid to ask for proof. A good doctor will appreciate your curiosity and take the time to explain. The best physicians want informed patients, not silent, fearful ones. When you begin asking these questions, something powerful happens. You shift from being a passive patient to an active participant in your care. You stop being a follower and become a partner in your own health decisions. And here's something most people never hear from their doctors: you have the right to say no. Refusing a test is not neglecting your health, it's protecting it. You're not rejecting medicine. You're embracing wise medicine, the kind that serves your real needs instead of blindly following a checklist. Now, if you're a woman over 70 who wants to stay strong, energized, and independent without unnecessary medical risks, there are gentle, natural ways to support your body. For women who prefer light daily support, I often recommend organic watermelon extract, rich in L-citrulline, a compound known to support circulation, heart health, and natural vitality. But for those who want a more complete foundation, supporting not just circulation, but also energy focus and hormone balance, there's a blend I often mention in my educational content called the Advanced Senior Vitality Formula. It combines natural ingredients, such as horny goatweed extract for energy and blood flow, tonkat ali for hormonal support, fenugreek for endurance and vitality, nettle root for urinary health, and concentrated L-citrulline for heart and vascular function. Together, these nutrients help maintain the strength and balance that protect you from depending too heavily on medical interventions later. The point is not to avoid doctors, it's to strengthen your body and make informed decisions. So when you do need care, it's the right kind at the right time. Your health, after 70, should be guided by knowledge, not fear. So here's my challenge to you. The next time your doctor recommends a test, don't just say yes automatically. Take a breath, ask your 3 questions, and think about what's truly best for you. You deserve care that respects your body, your comfort, and your years of wisdom. If this message resonated with you, share it with another woman you care about, because far too many are still suffering in silence from medical procedures they never needed. And if you haven't yet, subscribe and stay with me here each week as we continue uncovering the truth about women's health, aging, and vitality after 60 and 70. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you're experiencing symptoms, discomfort, or uncertainty, please consult with your healthcare provider. Your well-being deserves personalized care. Now tell me in the comments, have you ever questioned a medical test your doctor recommended? Did you feel heard when you did? I read every story, and your experience could help another woman watching right now feel less alone.